test. The NFL and other organizers say that they're confident that their plans to prevent the spread of COVID at the big game will work.
But we wanted to know, what's the real risk of infection at an event like this, and how well do prevention measures actually work? Our ABC 10 News anchor Derek Stahl is going in depth on a new study that offers some answers.
To sit in these seats for the Super Bowl, fans will have to show proof of vaccination or a negative test. And they'll be required to wear a mask inside and outside the stadium, except while actively eating or drinking.
And that doesn't mean buy a bucket of popcorn and eat it for 2 hours. Actively eating and drinking. We are on to you.
But just how important are masks in a stadium full of vaccinated and tested fans? A new study tries to answer that question. Researchers in Japan ran elaborate simulations. They estimated viral dynamics in the stands, the concourse, concession areas, and more for a 40,000-seat venue. And they found masks made a huge difference. With Omicron, the risk of a vaccinated person getting infected at a game was 16 times higher if they didn't wear a mask. When researchers compared vaccinated and unvaccinated fans, they found something surprising. A vaccinated fan without a mask is 4 times more likely to be infected than an unvaccinated fan who is wearing a mask.
The vaccines don't protect infection as an endpoint as well as they do disease.
UC San Diego's Dr. Robert Schooley says it's important to remember the definition of infection. It simply means finding viral RNA in someone's nose.
It decreases the likelihood of getting sick to a much, much greater extent. Masks, on the other hand, will, if you're not vaccinated, they may prevent you from getting infected a little better, but if you do get infected, you're much more likely to be in the hospital and in the intensive care unit.
When vaccinated people wear masks at a stadium and there's proper ventilation, the Japanese study found their risk of infection is about 13 thousandths of a percent. With 70,000 people expected for the Super Bowl, that best case scenario would mean about 9 new infections.
People who go to the Super Bowl should wear masks, whether they've been vaccinated or not, just because neither vaccination nor masks are perfect. When you put them together, you have the best protection.
The question is, will people actually wear masks come Sunday? A study on UK soccer games found fewer than 30% of fans actually do. Derek Stahl, ABC 10 News.
We will see. The NFL says it will provide fans with those KN95 masks, and there will be a signage of staff members to remind people to wear them.